All right, good morning, everyone. My name is John Nucleus. We're going to discuss the tactical solutions for workplace safety during the coronavirus pandemic. There is a question and answer, or Q&A, at the lower left of the screen, and we'll cover the questions and when we end this, we'll try to answer all the questions as we go through it. I know a lot of you had to download Adobe Connect, and that makes this presentation work easier. Monday, I also mentioned this at the end, you will get a copy of the recording as well as the PowerPoint too. So we're going to kind of first talk about the virus itself and just get everybody on the same level, as well as cover an update and then what to do for work and some of the issues that are, still in the future. As of yesterday, we had 1,000 deaths in the United States with 69,000 infected. This morning, I saw the numbers were up to 1,200 and about 86,000 infected. You can see the progression going in just less than 1 month time period. In the countries that are leading the U.S. in the deaths are Italy with 7,500 deaths. Spain is number 2, and China, where it originated, is at 3,200 some deaths. So there's over 500,000 today infected globally, and we expect probably the United States will, see similar numbers to Spain. Hopefully not as bad as Italy, but it's still early. What is the virus? It's a large family of virus that can cause illnesses in animals and humans. In humans, it causes respiratory infection. There's going to be some lesions. It's going to be kind of similar to Middle East respiratory syndrome, MERS, or severe acute respiratory syndrome, or SARS. And it is named the coronavirus because of the sun corona effect. It's not named after the beer. And the size of the particle itself is 1/8 of a micron, or 0.125 microns. And it's, a little bit bigger than Ebola, but, smaller than some of the other ones that are out there. The N95 mask that is commonly talked about, a respirator, or a filtering face piece, will filter out most of the particle sizes if somebody was to sneeze, and it is an effective method to protect the people. And what we've also learned is that there is a shortage for the person. If you go to a hardware store, you cannot buy the mask, nor probably find it online unless you want to pay $7.50, $10, $15 for these masks. But we'll talk about some alternatives that are out there because people are looking for alternatives. Similarities between the flu and the COVID-19 is that there's going to be some characteristics. The big 3 that a lot of people see all the time is going to be a fever of 100.4. There's going to be a dry cough versus a wet cough where you're spitting up stuff, and shortness of breath. Those are the big 3 symptoms. You can sometimes have vomiting and diarrhea. And it can be fatal in rare cases. If you look at the numbers between other countries, 1%, depending on, could be a realistic number that we're seeing. So it depends on a lot of the treatments. Treatment is coming up fast on this virus. So I hopefully expect by the time another 30 days, we'll see a lot more people being saved and killed. Can be spread by person to person, as the lower screen photo shows you that somebody's going to go out and cough. That's going to be a common transmission way, and that's why use of some protection around your face would help. Social distancing of 6 feet worked well with the SARS virus, and so that's what you're going to see a lot of places, from the supermarkets to meetings, start to push that distance away so people are not right on top of each other, because if somebody does hack and they have it, that's going to be an issue. The problem is this virus is a community virus, so that a person can be without any of the symptoms and be infectious and could have the virus spread through even contact with their skin. So we've seen right now 2 days to 14 days, is the infectious period. So neither virus, as in all viruses, are not treated with antibiotics, which only work with a bacterial infection. So they try to hit the symptoms, such as reducing fever. Acetaminophen or Tylenol is what they recommend. The French Ministry of Health came out with a recommendation: do not take ibuprofen or other things as it may make it worse. The World Health Organization says they need more research, but they have gone along with the French and said consider, avoiding those until we get, positive, more evidence. But like I said, the French Ministry of Health, you have to respect that. If you get all three of these symptoms, the fever, the shortness of breath, and the coughing, you got to let people know you're going to be probably going to a hospital, and they may need to give you a ventilator. There has been a shortage of ventilators. I was watching New York. They have 700 people on ventilators right now. They're hoping to get some more. And that's been a increased shortage. Companies like Medtronic are working 24/7 to make these ventilators, but it doesn't make, them very fast. It's a complicated machine, and it'll take, couple days to even make one. So some of the other simpler things on treatment, we want to make sure we're washing our hands. The big thing with this virus, because it is infectious and it, you can pick it up on the surfaces, we want to disinfect the surfaces that we're going to be working with. You can use wipes, you can use soap and water, you can use hydrogen peroxide, you can use a bleach solution. We want to stay home when we're sick, and we want to make sure we're trying to limit the contact. We always talk about the proper way to cough, which is shown up in the slide. But hand washing, I always push, if you come out to a supermarket, make sure you sanitize your hands when you get out of there. Before you eat, make sure you wash your hands. Those are two things that I think are a little bit different than the other viruses that we've seen. We want to make sure, because it is very infectious and can live several days outside on the surface itself. Some of the things that we've noticed, when we look at the deaths, the older you are, the more likely the fatality rate has gone up. So it's an unusual disease, unlike influenza, which tends to hit the older and the young kids. This one tends to hit the older ones. But they've in California, they had this week a person die that was a teenager with no apparent symptoms beforehand. So it isn't immunity at that level. It is something that the older you are, it's a problem. So people who are healthy can develop symptoms and be in a situation they might be in the hospital on a ventilator too. So when they get transmitted, it's airborne drops. The tiny droplets in the air can cause disease even if you're not nearby. And so we have to think about, anything you're going to, where people could cough on or even, breathe on, that, any of the droplets, and the key word is droplets, you'd want to disinfect. So if you're in an office environment, this is going to be a keyboard, a phone, places where people are going to touch that other people would touch. The incubation period, 2 to 14 days. It's been all over. Different groups have had different numbers, but they have found people to be infectious. And this is what's disturbing about this virus, is that you have to remember that if you have somebody that could be, let's say, 25 years old, and they look healthy and they have no symptoms, they could be carrying the virus and give it to someone else that is more susceptible to this virus, that has some either pre-existing health conditions or other issues. And again, the life they can have up to 9 days, everybody agrees with. The CDC went to a cruise ship 17 days later after they evacuated and found that the virus was still alive 17 days. So common ones you're going to see that people are going to use isopropyl alcohol at 60%. I wouldn't recommend using vodka, 60% or 120 proof. But you can make very simple ones. Simple like this would be a isopropyl alcohol with some coconut oil, just for moisturizing. Isopropyl is also, in high demand, so you may not be able to find it. Disinfecting wipes are also in a high demand, but you can also use soap and water. Hydrogen peroxide will work, and sodium hypochlorite, which is a light bleach solution, works. This thing is easy to kill with disinfection, so it's not an issue where it's a tough virus that you would have to have something very specialized. So common things, 4 different things that you can probably get. Everybody's got soap and water, and just putting it in a mister and stuff like that would work also. Antiviral medicines are being tested. The big one, of course, is hydroquinine and hydrochloroquine, which is quinine in more strength. So this one's 100 milligrams. It does require a doctor's prescription. There's been people that have been successfully treated with this. So this with erythromycin, an antibiotic, seems to have a positive result. So that's why I'm more optimistic in the future. Several people on social media that I've seen or friends of a friend have had coronavirus and have developed recovery based on some of this treatment. So that's been a good thing. The vaccine is not out. There is some limited testing that has been done in Washington on people. Again, people want to try something very quickly, but we have to be careful that the vaccine is not worse than the disease itself. So, usually it's going to take a minimum of a year to get a vaccine out there. That doesn't mean we're going to be living like this in a year. I think the treatment will happen fairly fast, and and prevention will be a key in the future for the next several months. And again, one of the things, it is training. A lot of people, they don't know if they have immunity to it or what, but South Korea and Italy has done a lot of testing, and in the red marks is the Korean ones that they found sometimes people in the 20s, 29% of the cases, they were testing positive, but not a lot of symptoms. So that's something you have to think about, that the young group can be very infectious and not develop the symptoms, but create a vector where they're going to infect somebody in the older realm, which could be a lot more susceptible to getting this disease. Usually it doesn't go to the animals, but one case in Hong Kong, they had a dog, which is a Pomeranian, get a mild version of this disease, or a weak positive, they call it. So there's different agencies that it can happen, but I'm just saying, it has been reported by Hong Kong's health department, and you have to at least consider that issue. So what happens when I go back to work? Well, we're going to try to make sure we can do social distancing at our workplace, that we can make sure people are going to be at least 6 feet away. We're going to talk about the 3 methods: reduce transmission among employees, maintain a healthy business operation, and maintain a healthy work environment. And when we go back to work, we want to talk about these things with employees, because not everybody knows all these things. We want to talk about how often you're going to wash your hands. You got to have soap and water or disinfection. Like Perel, you're not going to be able to buy. I mean, I've not seen anybody seen that in the stores in the last 4 weeks. But there are the equivalents that are out there. Avoid touching the eyes, nose, and mouth with the unwashed hands. We want to make sure that if they're sick, that they're going to stay home. We want to make sure that's encouraged. Now, this is a problem in certain industries like part-time work, fast food, construction. If they don't go to work, they don't get paid. So you have to think about making a policy that might give a little bit more assistance to these workers, because otherwise you're asking the sick worker to come into work and then possibly infect your whole work site. Want to talk about making sure everybody knows how to cough. You're going to have either the cough in the crook of your sleeve, or a napkin, or a tissue, or a handkerchief, or something else, because again, this is something we learned about 10 years ago, but we want to make sure everybody does know that, and that's something you want to cover with your staff. So you can always buy temperature gauges. There's many different versions of them. They're not cheap. They're over $100, so under 150. But they can just measure the temperature on the forehead. The idea is that you're going to look at 100 degrees, 0.4, and that would be a temperature where you'd probably want to make sure you're getting some medical attention, at least looking at it. And again, with these devices, there'll be limitations, like you have to have the person inside the room for 30 minutes, because if they come right out and it's cold outside, they're going to test cold, and vice versa if it's exceptionally hot outside. But I always talk about develop a person who's going to coordinate and keep up on the issues at the facility. That could be HR, that could be safety, or if you're a small place, that might be the owner. And then think about a sick leave policy, because you don't want to keep your workers, but you don't want to have sick workers coming in and making it worse for everybody, because that could run, and take out a lot of the people in your company by self-quarantine or mandatory quarantine. And again, a lot of people said if you're in this quarantine for 14 days, we want you to get a positive COVID-19 test. Well, that's not really practical right now because of the testing. There's the U.S. has done well over 500,000 tests, and but there's not 10 million test kits available that we can go out to a Quest Diagnostic and say, here, give me a test for this thing. That might eventually come by, June or so, but we've gone up and ramped up thousands and thousands a day now we can test. But there's going to get the people who have the symptoms, try to hopefully get them while they're early with these symptoms and get treatment while they're, developing just only a cough and not waiting for the big three to come up and possibly put them in a hospital. And you want to make sure, if there's some things you can do, if the more ventilation, the more it dilutes it. As the health people say, dilution is a solution. And we want to make sure if you can possibly increase the ventilation rate and get the building air out, it's going to dilute the amount of virus that's in the air. We want to also talk about, in the maintaining a healthy work environment, we want to make sure we have enough hand sanitizers or other devices. Talk about, don't touch the areas that are common. Plenty of soap and water in the workplaces, and that's got to be checked because you're going to be surprised how much people are going to go through soap and water as well as disinfections in there. I mean, I've had some of the landlords at these multi-office buildings. They got the Purell sanitizer or the equivalent, and they've literally duct taped them on tables at every elevator so that people won't take them. But they're finding out that it's being used heavily, and it's a matter of can you get a replacement on this. And again, put it in several locations. Definitely where people are going to be, high traffic areas, and put some posters up there that talk about the issues. And again, I always talk about maybe washing your hands before work, washing your hands after you get done with an area that there's going to be places out there. Disinfect the area that you're going to go into. It's new. Discouraging handshaking is definitely in there, and that's hard for a lot of people to break. But as we saw today, England's Prime Minister Boris Johnson just got it, and so he's in self-isolation after testing positive, and he was a big handshaker, as well as a lot of celebrities and other ones. So we want to make sure that we can keep our distance and just acknowledge a person without shaking the hands. And then make sure that we routinely clean and disinfect the surfaces. So a lot of times, like I said, if you just wipe the surface off with a cloth, that's not going to be good. There's different cleaning wipes, and I always tell people there's plenty of soap and water. We have not run out of soap at all, so you can put it in a spray bottle, you can spray it, and you just wipe it off. Obviously, electronics, you'd want to try to use a wipe because you don't want to get your keyboard wet and everything else. But there's a lot of different things. Some of the people are going out there, and if and here's where I got it, is these little sanitizing wipes. Sodium, it's a benzoyl zirconium chloride disinfectant wipe, and it's kind of like a wet nap, but you could take this and you could wipe this on different surfaces. And Granger sells these and has not run out of stock to my knowledge. But these would be things that you can go over and you can wipe your hands, and then you can wipe down all the surfaces, your cell phone, anything else that would be in the area. What can we expect next? Well, the testing is ramped up. I think the U.S. is going to probably lead the world in the testing in the next 30 days. The test kits are coming out by thousands and thousands a day. I get to watch Illinois' data, and we've tested, well over several thousand already, and that's why numbers are high. The next one, like, some states like Louisiana, which didn't have a lot of test kits till really this week, you're going to see a ramp up of cases. So, I expect 1 million cases of, COVID-19 in the next 30 days in the United States because the testing was going to be, or not 1 million, but, well over probably almost 500,000. They're going to be playing with the different drugs. Again, we got hope of, the erythromycin and the quinine-based drugs. And we're going to hopefully get enough of these respirators out. I got 3M saying they're going to be able to do about 100 million a month in the next 30 days. So there's going to be a lot of stuff changing in the next 30 days versus the last 30 days. And again, we got to talk about how we're going to get to work and how we're going to be able to do work. Right now, a lot of places like in Illinois, we're on shutdown for almost 2 more weeks, and then people are going to reevaluate what do we want to do. If it's still going up geometrically, we're getting a 4-time increase every week. I don't think we're going to get off the shutdown, but if we can get to the point where the rates are going down every week, then you could start seeing possibly easing of the requirements. So the big drug that everybody's talking about is the hydroxychloroquine and chloroquine. They're prescription drugs. As one person said, there's thousands of doctors, issuing prescriptions for them and their friends, and just because people have these issues and they know it seems to work. But like I said, this is something people are watching, and like I said, there's some anecdotal evidence that works. It's a lot of social media evidence. So again, it started with a non-peer-reviewed study in China where they saw the benefit along with erythromycin, and and again, non-peer-reviewed means there's not enough time for these health organizations to really take a look at the study and verify it and say that this is meets all our criteria. Another one in China talked about a lot of the COVID-19 people were low in potassium, hypoalemia, and one of the things that people are starting to look at is, well, the way to get the potassium in is to eat a lot of fruits and vegetables. For example, 4 prunes has 310 milligrams of potassium. Some drinks like this, Bai drink and stuff, same thing, same 310 milligrams of potassium. Again, a lot of data coming out. There's no peer review on this issue, but this is something, that when the Chinese health department says this seems to be working, they were right on the first one, so maybe they're going to be right on the second one too. But a lot of times I go to the store, and the things that are out of supply are bread and eggs and milk, which are not the high potassium items. Plenty of this stuff is very cheap and plenty available right now in the stores. The N95 respirator, this is the respirator that we've used for years. It's dropped the silica from thousands of deaths to maybe only 120, 130 a year from silicosis. I mean, it works. They would use a smoke tube or stannous chloride. We would go in there and measure the effectiveness to see if a person would involuntarily cough with the smoke. So I've been playing around with the different ways of other things that might possibly work as a substitute till we get some of these in the store. Right now there's a shortage. If you go to any store, the medical people are going to get the priority as they should. But I started looking at the smoke tubes, and there's a couple videos on YouTube that I put on John Newquist, Will I Cough? ? But the first thing, Elizabeth, she came up with a 100% acrylic scarf, double wrapped, and it passed this smoke test twice. First time we did it, we thought, well, maybe it was luck. Let's come back another day. We did it again and did not cough. And we think it's possibly because when I wear acrylic sweater or shirt, I get shocked a lot, and maybe the electrostatic potential is going to take the droplet and catch it before it goes into your lungs. Furnace cloth filters that 3M made, that's called the 1900, which looks similar to this. Just take out the filter out of the box and go through it. Alex is using a triple layer. Now he's making a seal on there because, this is the big issue. If you don't have a seal, the openings, when you breathe in, will suck in the droplets. And so this one worked and passed the smoke test too. So that's an option that somebody, can also look at. These are until we get, the proper respirators. And like I said, if it passes these tests, it's not a bad thing. Again, we don't have this time to do a scientific study and say, we did this 100 times, it passed 100 times. Some other ones, the bandana respirator is what I've been, had several companies tell me they're going to make the employee. This thing will not work. It instantly fails, and it fails the smoke test, as we use another one called Bitrex, which is a bitter tasting. It fails both of them. It is a worthless idea. It will never work. The other one is this popular cloth respirator. Now, you put this on, but as you can see, there's nose. I can almost stick my fingers and touch my nostrils in it. You're not going to have a seal. So Alex is making the seal, and then we just put the 3 layers of the furnace filter in this. Donna from Portland sewed this up for me. And just if we made a good seal with it, it actually did stop the smoke from coming in, and it worked. So it's just a matter of, could you make this a seal? Right now, you would not pass a test if you just wore it because of the entry through the nose. Another one Chris came up with is the same furnace filter with a resuscitator that they use in first aid CPR, one layer. The exhalation valve prevents most of it from coming in, but that, again, he's doing it with a seal. You'd have to obviously modify this to get a correct thing, but these are just some options on here. So I wanted to go over some questions. I know we got a lot of them over here, and let's see, I got, quite a bit. Can I repeat the meds to take and not to take? Tylenol, acetaminophen is good. Ibuprofen, no. So Motrin, no. We have had an employee notify us that he was hanging out with his brother, had someone who was in direct contact with a person coronavirus. Would you require self-quarantine or not? Well, you have to presume that the person who was infectious could have passed it to that person. So yes. So I used, the Congress people, because a couple of them had tested positive. Rand Paul was the one that's probably the most famous of the senators. And he was in a meeting last Friday, and so all the senators that were with the meeting are in 14-day quarantine. Even though they have no symptoms, the idea is that you just don't know when you will develop the symptoms, and 14 days is usually a good period to say go through it. I have another one of my friends that are in self-quarantine. They came in contact with somebody who had that issue, and they're coming close to Sunday would be the 14th day for them. The virus on various types of surfaces. How long it remains infectious. The cruise ship was 17 days. There's some studies that have talked about plastic and metal, and being 4 days they've been able to document it. So the question becomes, are you going to decon the work surfaces? Sure, you're going to go out and hopefully get some wipes or soap and water or something and wipe down the common areas that you're going to go into. And that'll be anywhere from the doorknobs to the handholds to the stair rails to everything else that people would normally touch. And that's all you have to do is think, what are you going to touch during the day? Well, you're going to touch your keyboard, you're going to touch your phone. You need to sit there and disinfect that. And then if you have to come and use somebody else's area that has that, you would also disinfect it. You can get the wipes or you can get some other ones. I like the wipes for anything electronic, and then the rest of the stuff you just spray and wipe down. It's not so bad. Number 4, make sure you get a medical thermometer, not some to measure temperature from a machine. Well, this is nice to say that we'd have like a thermometer we can stick in our mouth and stuff, but these Braun thermometers, these are pretty good. I mean, and the reason I'll say that is when I've gone to the hospital, this is what they're using on me, so I would say that's probably good evidence. I mean, you're buying something that the hospitals are using. Again, the old thermometer you stick on your tongue, that's probably the most accurate, but this has been pretty good. The big thing that I run into is you come right in the door, they hit you with a thermometer, it's not accurate because you got to wait and let your body adapt to the room temperature and stuff. So that's a common mistake I will run with the other one. Number 5, is OSHA recommending PPE for those taking temperatures at work? Well, I would say if you're going to be in this 6-foot barrier and you're going to do stuff, you'd want to be wearing gloves and a respirator. If you notice there's any kind of a cough possible, you want to probably wear goggles too. Now, goggles are starting to get a run on the safety supply stores, but most of them are still out there. But, that's something you definitely want to consider, is that having some kind of protection while you're doing it. When you go to a hospital now, they're wearing the gloves, the goggles, and the mask when they're taking the temperature. If someone is feeling shortness of breath, would a CPAP home help with breathing? Well, it depends. It depends what the shortness of breath is. I would say the CPAP's good for sleep apnea, but the ventilators are it looks like you're in a solid cocoon of plastic, and they're pumping in the air in there. So I don't know. I haven't seen any numbers on the CPAP with helping on the breathing on that side, But again, I would always say if you got shortness of breath, you always want to contact a medical provider, because that is one of the 3 symptoms, and you want to take a look at that issue. What are your thoughts on fogging machinery and hardware as international? Well, I've gone and watched China and several European countries. They literally look like persons dressed to spray pesticides, but they're just doing everything else. Well, the theory is if it's on the surface, from a light pole to a doorknob, and it's a disinfection that's going to kill it, you would have to say it has some benefit on it. It's the issue of, do you have right now we don't have the equipment. The Tyvek is in limited supplies. You could still buy it on Granger, but I watched nurses up in New York, wearing garbage bags because they don't have enough Tyvek. So, and Tyvek is a plastic impenetrable suit, so it's an issue. I don't think it'd be very. I know a lot of companies are going to start thinking about doing this, and they've got Tyvek from doing some other hazardous waste material equipment, so it could work. And you have to look at it. China did it, and they've had a couple days with nobody getting sick. But again, their data is not exactly transparent sometimes. Any thoughts of the safety implication for using the Coronavirus Response Act? The facilities are not complying. This is could there be lawsuits for places? Well, lawyers have looked at this issue, and they've talked about people should have some kind of program in place. I mean, the one thing that's been in there is if you have somebody that tests positive for coronavirus, the first time you probably can say it may not be work-related unless you're in a high hazard occupation like healthcare or something else like this. If you're in a construction site in an office, maybe that's a low healthcare issue. But now you've got somebody that's tested positive. Unless you disinfect the facility, you'd have to presume all the other exposures would be, possibly in there. So you have to take some precautions and do a deep clean after you've had person get infected. That look at the areas they've been in and where they've touched and try to disinfect it. Otherwise, if somebody else gets sick, they're going to say, I got sick because you didn't clean the area, and that's what goes up in for either worker comp or lawsuits. So, and it's something to consider for sure. OSHA complaints and response, I know they're going to call people up. They're not going to go out and do these inspections right now. Most of the OSHA people are at home writing up the cases. They're doing the fatalities and the amputations. They're probably going to call the companies up about anything with coronavirus. Number 9, suggestions for training new employees while maintaining proper precautions. Okay, the National Safety Council came up with some guidelines. Want to make sure that nobody has any of the 3 symptoms. You're going to be and if you look at the White House press conference, they got the reporters in a chair 6 feet away from everybody. So it's kind of like a checkerboard system. You make a 6-foot square, you put the chair in the middle of it. You could do this stuff that way. You disinfect the surfaces before you do the work. And you could do that kind of training that would meet the guidelines. But, that's going to be a big change for a lot of people. And do you have enough room is going to be an issue. You might have to have a couple meetings. Teleconferencing or video meetings like this is a lot better alternative. You have to really say, do we need the people in the room to do this? And for hands-on training, unlike if you're in a factory and you're going to go teach somebody how to work on a motor, you're going to need to do this. But you have to start thinking about disinfecting things after somebody has touched it. Because remember, the community carrier has no symptoms and is infectious. So we have to, go with that scenario that they could touch something and get infectious, and then we could be, transmitting it to other workers. The misconception of electrostatic spraying and fogging as deep cleaning without performing other steps. Remember, every cleaning and disinfectant has a dwell time on the surface being wet. It does. You're right. You have to let it sit for a second or so. I mean, I don't know what the exact time is, but a lot of the fogging and spraying is not done properly. That's true. But I mean, like I said, China has done it very diligently, and it has made a difference. I got to believe that's one of the things that's made a difference. My question is, how much health hazards are you creating by spraying, thousands of gallons of disinfectant in a city? That's another issue. Did OSHA waive respirator fit testing for construction companies during the pandemic? They waived it for the half mask respirator, not the filtering face piece. I have a feeling that, just getting in and doing a fit test, you're going to have to use a respirator here. You're going to have to get if you're lucky enough to get these half mask respirators, you're still going to have people go through a user seal check, which would mean they'd have to blow out and see if you got a good seal. And I got, because I have a broken nose, I feel a little bit here, adjust it, now I'm good, and then inhale, breathe in. You still have to do that. Now, you can give them a smoke test as a quantitative, or you can do a qualitative fit test, either one of those. I think OSHA is going to be fairly lenient on that requirement, because just the fact that you're probably not going to be able to buy everything right away. and go through it. But technically, they did it for the half-mask respirator. If you train people how to use it, they did the proper user seal check. They could they have a policy on their site they would not cite. Will you share more details on N95 alternatives? Right now I was just doing a quick screen of these tests that you see the photos up on here. I had other ones like the diaper, because I saw a guy wearing a diaper and I thought, well, let's try the diaper. You could put this on, and boy, that failed fastly too. But right now, the acrylic 100% acrylic scarf has passed every test. The furnace filter one, if you can get a good seal on something, has been very effective. And you would think, this little thin fabric, would stop it. But if you triple layer, which is not thin, this stuff is very thin. It's pretty easy to do, but you got to have a seal. Otherwise, it's going to come right through. What's the best way to disinfect cut-resistant gloves our employee wear? Well, ultraviolet light is a common way to disinfect a lot of that material. So you could just have a UV lamp and that would work. Technically, some gloves you can wash, some of them you can't wash. Soap and water is a great way to disinfect a lot of the stuff through washing. Okay. Any other ones, Petey? Okay. Disinfecting of a pre-cleaned surface neutralizes a pathogen. You need to perform a cleaning process, then disinfect and properly neutralize a viral pathogen according to CDC guidelines. We have to make sure that we're performing and not paying for smoke and mirrors or snake oil service. And it's recommended to do a deep cleaning to prevent secondary exposure to touch points. Correct. There's a whole guideline on CDC clearance and everything else. EPA has lessened their enforcement on some regulations during the outbreak due to lack of staffing. Does OSHA have any plans to follow suit? Right now, no. OSHA has only given the issue for the half-mask cartridge respirator. If you don't do the fit test, the quantitative or qualitative, they would say during this crisis they're not going to cite it as long as you've done the user seal check. Again, everything is fluid. There could be a change next day or next week. So a lot of the issues, OSHA staffing is, their primary thing is to deal with the fatalities. The record keeping is something I get questions on every day, and people are very conscious. If they have a person develop it, was it work related? And the key thing is, did the work environment contribute to the coronavirus? And for most people, you can say no on the first case, but the second case, once you have somebody, then you have to probably say it could be, unless you've proven you've done a fairly good cleaning job or something. Since COVID-19 would be deemed recordable under record keeping, how do you determine work relatedness? Well, that's, again, is the issue is if you have somebody that has had COVID at your workplace and you did not clean, you have to presume everybody else got it from workplace. I mean, that's a reasonable presumption. If you've gone in there and you found out you had somebody in there, now you got to remember, if it's they came in Monday to Friday, they could have been infectious Monday. So people who worked, and after 14 days didn't get any problems after you cleaned it on today was a Friday, you could probably say, well, we passed the period, and now we're talking April 19th, and they got COVID. It wasn't related to that. You can make that case. There's going to be a lot of questions on this, but the issue is, can the work environment have contributed to that person getting the COVID-19? If infected with the COVID-19, do any over-the-counter expectorants help with the symptoms of the cough? Well, not really. It can suppress the cough. It'll help. It'll make you feel better. But they have, there's prescription medication that they can give you for this too. But anything that's going to help you get rid of the cough would be nice. It's just I don't know of any over-the-counter one that is going to work if it's coronavirus per se. Any recommendations that a worker in a construction site of 50 who tests positive? How should the rest of workers proceed in site with seeking medical attention? Well, currently the guidelines, if you're in contact with somebody that has COVID, which is at a construction site, technically all 50 workers would be in self-quarantine for 14 days. And this is where it's going to be a problem, and that's what we have. have done. They've, this whole idea of separation, isolation, ideally we'd be able to take all 50 of the workers and test them and see if they're positive or not, and then maybe come back a week later and test them also. But that's not practical right now. There's not enough test kits, and the priority is for the people with the symptoms and stuff. But again, that's how they were handling it for everything else. If you were out there at a workplace, whether it be a restaurant or a healthcare facility, if you had a person with COVID, the people were getting isolated. Where can we find the NAC guidance on new hiring and training you mentioned? I put it on my Facebook site, but we can have that sent out to you of what they do. They actually have the participants sign that they are healthy and have none of the symptoms also. I thought they waived the annual refit, but not the initial. I would have to check that one, but let me pop it up real quick. You go to OSHA.gov, that's all I'm going to go do. There's a whole COVID site here. Let's see if it's got anything about the respirator on it. Otherwise, we'll just have to spread. Okay, there's a memo, March 14th, 2020 is how you find it. And it says, appropriate respiratory protection is required for all healthcare personnel providing direct care. Field offices will exercise enforcement discretion for the annual fit test requirement. If the employer made good faith to comply with the respirator standard, they're using NIOSH respirators. Perform initial fit tests with each healthcare provider. So you're right, that is correct. It's going to be initial tests. Inform the workers that temporarily suspending the annual fit testing of the N95 filtering face piece respirator reserve and prioritize the supply of respirators. So you're right. I'm sorry, I made a mistake of saying it was for the initial one. Irritant smoke test. Work as a fit test on a P100 filter and a half mist respirator. It should. It should. I got a N100 lead respirator, and it works on that. Some people use Bitrex. There's saccharin tests. There's corn oil, banana oil, depending on what type of respirator you have. Organic cartridge runs, you'd want to use banana oil and stuff. Is COVID-19 a recordable claim? That's the question everybody's asking right now for worker comp. Did I get it at work? Was it work related? Well, the answer is yes and yes. There's a potential case that it could be recordable. And that's where, people who are going to do this cleaning, they're saying, well, my people could get sick by cleaning, and that's the answer is that's potential. So, every state has their own worker comp rule. There's not a national worker comp rule. So each state might take this on a little bit differently, but that's an issue that a lot of people are preparing for, that it is potentially a work-related issue. Should N95s be limited to one use, or can you follow CDC guidelines that reuse is acceptable? Well, they were designed for one use, but you got to remember, you're not out there with silica with these. It's not going to clog up with the COVID-19 virus. But you have to be conscious that this is not designed for 40 days of use. This thing was probably going to break a strap or start to lose its seal and effectiveness. So you got to replace it when you can't get a good user seal check. When I go in here and I put my straps on and I blow and my fabric is not sealing, and no matter how much I adjust it, I can't get it. I'm feeling air blow out through my nose or through the bottom of my face. Then you have to get a new respirator because it's not going to really protect you. CDC recommends 14-day contact with people in close contact that works in the same building, not as, would the whole site need to quarantine? No. Again, but the issue is, you have to look at what the person did. If I'm on the first floor and the person on the fifth floor has got it, well, let's hope they disinfected the elevator and stuff, other areas that we went through it. But no, you wouldn't have to do that. Again, what we have to look at is, are you within the, close contact? We've already seen the, congressman get self-quarantined because they're in the same meeting room with, Mr. Paul. So this is, again, there's no rules that are written in OSHA for, self-quarantine or everything else. A lot of this could be what the Illinois Department of Health Department requires everyone to do, or the governor's office requires everyone to do, and it will be inconsistent across all different work sites. So, again, if you're in the area and you're working in the same office together, you're probably having simpler things that you are touching. OSHA suspended the annual, but is expecting employees to do initial fit test. That's what I just read. N95 do not require fit testing. Yes, they do. This N95 respirator, NIOSH approved, does require everything a written respirator program does, unless you make it voluntary for use. Then you have to apply to Appendix D of the respirator standard. This is considered a respirator by OSHA. And the recording and the PowerPoint will be emailed Monday. And there's just a few more questions here. Okay. Is a railroad environment employee considered an essential worker? Well, that's one thing that's each state is completely doing different things on. Essential could be railroad. If you look at China, they shut down the Metra and the CTA version out there, and we have not done that in Illinois. So, essential is in the eyes of that particular state. If one employee tests positive for 19, is mandated guidelines for all employees. Well, the issue is how, again, goes back to that state. If you're a conductor in a railroad and you're working with, another person, you presume probably to be fairly close contact, and I would think you'd want to at least probably self-quarantine. Now the question is, you're going to run out of people. What are you going to do? So, I mean, hopefully you can get a test for these people that are in there, and you can say, okay, you don't have any symptoms and everything else. Could you self-quarantine? And, I mean, the whole issue is this things with the doctors. We have doctors who are, positive for COVID-19, saying that I want to go in and just work with the COVID-19 patients and I'll be okay. And that's a interesting ethical issue too. So I don't think, if you can self-quarantine, you want to do it. It's just that, it's going to be an issue if you start to lose critical people in essential businesses. Could manufacturers spread the virus through making the product and selling to the consumer? In older buildings with HVAC systems that do not bring outside air, is it advisable to run the furnace continually? Well, the whole issue is if you're going to recycle the air and you got a COVID-19 person and the virus was known to live, at least minimum 4 days, going to float in the air on your air, and if it's like the CDC at the cruise line, it could be 17 days, then, you have to start thinking, wow, we're not really going to do much. You can put HEPA filters in your ventilation system, but that's, presuming you had some fresh airflow coming in, and if you're just recycling the air, that's, it's not going to help any. Irritant smokes are only used to test the N1, not the N95. Bitrix and section B for the N95. Okay. Like I said, I don't run the N100 that often. Again, you have to follow the OSHA respirator guidelines, and again, you have to do a quantitative or qualitative fit test for all these respirators. The N95, the irritant smoke is common, Bitrix is common, and both of those are easy tests to do. Bitrix gets to be fairly expensive if you use an ultrasonic nebulizer, because every time you'd use it, it's done. Whereas a smoke tube, you can go, use a smoke tube fairly on several different people to do the test, and you can get a full day's or maybe even 50 puffs out of it sometimes. How long can the virus stay alive in metal and plastic wood? There was a survey, and I can't remember who did it. Uh, the maximum, I think, one of them is 4 days, and I can't remember if it was just metal and plastic, but there's been cases up to 4 days. And again, when the CDC went to the cruise ship, they found on some surfaces it was live after 17 days. So, I always tell people at least 4 days, on a common surface. And, like I said, that becomes up the whole issue of packages could be infectious. So Amazon's out there telling people trying to disinfect after you take a package or you handle it. I would say, well, wear the gloves for sure, and and think about that's going to be an issue. You want to probably start opening packages with gloves. Irritant smoke can be used to fit test an N95. That is correct. We've used that forever, so I know that's a common one. I just don't see the N100s. I mean, maybe somebody else is getting a lot of N100s out there, but I'm seeing almost all N95s out there right now. What do you do for remote workers who don't have access to water, washing hands, and can't purchase hand sanitizer? Well, it's called soap and water. Go out and start taking some of these and fill it up with soap and water, and you can do that. I mean, if out of Bitrix I can't get any sensitivity solution would be in there, what would the number of sprays be dissolved? I'm not sure. If I can't get any of the Bitrix solutions, should the number of sprays be doubled? I'm not sure I understand that question. One of the things that people are asking about in the quinine, is this tonic water. Well, you saw the one pill, it was 100 milligrams. I mean, this on average has, maybe 83 milligrams of quinine in it. So, there are people who are drinking this, but 1 liter, it's not going to be equal to a pill of 500 milligrams. But the doctors will prescribe the proper amount if that's a treatment they're going to use for this virus. Why would secondary COVID environment consider recordable and other illnesses flu standard? Well, because OSHA said it would be recordable if the work environment contributed to it. Whereas regular flu environments, they said no, we weren't going to require it. Now, next month it could be a different position, but right now they're saying if it meets the requirements, there's like 3 criteria in the OSHA.gov situation, which is the work environment contributed to the possibility of the person developing COVID-19. And that came out last week, so that's something you want to read. Will an NP95 work to filter Corona 95? Well, the 95 means it's going to filter out the particles in the air if it's NIOSH approved, which there are a lot of respirators out there being sold as good respirator. But you go over there, there's going to be a NIOSH approval on this one. This is a Moldex respirator made in the United States. They're going to have on this straight, it's going to say the NIOSH has approved this. It's an N95 respirator. Otherwise, people are making these things that look kind of cool, but there's no proof of testing. And that's where I'd use the irritant smoke to see if it passes it or not. I mean, otherwise, if it's just like these bandana respirators I'm testing, they're failing every time instantly. I mean, there's not even any protection on them. Can you use sensitivity solution for testing if you can't get Bitrix? Well, the issue is, does it meet the OSHA standards? I'm not sure. I mean, I guess I haven't run into that solution. I haven't seen what OSHA's position is on that one. I'd have to go dig into it. All right. The reporting in PowerPoint will be emailed Monday. Thank you very much. I appreciate everybody coming in. And like I said, they plan on doing another one of these in the next few days, and then some of these other issues that we might go more on the respirator side. It looks like there's a lot of questions on respirator and recordability, so we'll focus on that next time. Thank you very much.